Well, they say that an ounce of prevention is worth a pound of cure, and when it comes to preventing falls, that's some great information to have. And to give us that information from Therapeutic Associates is Kayla. Kayla, thanks for joining us.
Thanks for having me.
Now, I know that a fall could be very detrimental to seniors or anybody else for all that matters, and you have some tips and suggestions on how we can prevent falls. Is that correct?
That is correct. You know, as a physical therapist, as we start to get into the winter months and things start to get icy, we do a lot of educating on the senior population about fall prevention. A lot of people have a tendency to be fearful of having falls, and therefore they have a tendency to stay in home a lot more.
Right.
Therefore, they're not active, they're not doing things to try to avoid the fall, and that has some other kind of negative effects once they do that.
So it almost seems like what they're trying to do to avoid the fall is
Right.
actually counterproductive
Right.
to actually avoid it. So what are some of the tips that you can provide for us in fall prevention?
Well, there's multiple factors that you want to consider when trying to prevent falls. One being to check with your general physician about your medications. So make sure that they don't have any negative side effects that may affect your balance, cause vertigo or dizziness. That could definitely contribute to a fall. You also want to check with your optometrist about if you have glasses or if a senior has a prescription that is not necessarily correct that could contribute to tripping or not seeing an object that they could trip over.
Yeah.
And as far as tripping, footwear is also very important. People have a tendency to wear shoes that aren't quite stable on their feet or a little looser that can slip and they can trip on them, or something that has a slick bottom. So you want to make sure that your shoes fit nice around your foot and they have a nice traction on the bottom, so that if you get in a spot that's a little icy, that we can keep your balance.
That sounds great. And you also mentioned that staying active really helps with that. What are some of the things that you can do as far as staying active that will help in fall prevention?
Staying active is probably the part that we deal with most as physical therapists. Getting the senior to walk. Walking is a very good activity that they can do on a regular basis, even if it's 10 minutes at a time. Just get out and walk. Things to consider while doing so is making sure that the surface is a nice even surface, so it's not a jagged sidewalk that they may trip and fall. Make sure that they have the proper assistive device so that they're not walking unstable.
Right.
There's also a couple other opportunities around the community in which an individual can stay active. There is local gyms which provide aquatic therapy or pool classes that are designed for the senior population, so they can get involved in that. There's also other exercise groups around the area that provide more of a designed program for the same population.
That sounds great. And they should, of course, either talk to their doctor or a physical therapist before starting any type of exercise or strengthening program.
Definitely.
Well, great. Well, where are you guys located?
We are on 15th and State. So if anyone has any questions, feel free to come in. And we do recommend that before starting any exercise program or exercise specifically for the hips and ankle, that you get medical advice from a healthcare provider, whether it's a physical therapist or your general practitioner.
That sounds great. You guys are located in downtown Boise, and then you also have a website available?
We do have a website available.
And your website is?
TherapeuticAssociates.com/State Street.
Okay. And phone number?
Our phone number is 336-8433.
Well, great. Well, thank you so much. We really appreciate the fall prevention tips.
Definitely. Thanks for having me.
Thank you. More ETV coming up right after this.